name's Karen Darling and I am the manager of the Women's Health Information and Support Centre. What we do at WISC is we offer a menu of activities, of groups, one-to-one support and group mental health support to empower women, to encourage them to take control of their own health by offering up-to-date information, by offering support, by talking through with them what the concerns are. We don't have counselling, we have a listening ear service, and that's a one-to-one space where women can just come along and speak to another woman, one of the trained volunteers or one of the staff, in confidence about any health-related issue that is affecting them at the moment. For many of the women that we work with who are facing extreme poverty, they are in digital poverty, they cannot access health appointments because that's not in their own community, because that forces them to choose between paying for food or paying for bus fare. For many women in kind of disconnected communities, it could be 2 or 3 buses to get to health appointments, and that is just too unaffordable for many people. We also work with women who are neurodiverse, women with severe and enduring mental health issues, with complex physical and mobility needs, and all of these are barriers to them achieving their optimal health. The women we work with are often quite isolated. They could be isolated from family and friends. They might not have a great support network to kind of encourage them to make sure that they're living safely, to make sure that they are attending health appointments. Many of the women that we work with have care needs. Many of the women we work with have care responsibilities. Women generally will put themselves at the back of the queue, so they'll make sure everyone else is okay, but often that means they don't attend their health appointments, they don't recognise when their own health is deteriorating. Often women will come to us experiencing issues like poor sleep quality, they have severe anxiety, but they haven't discussed this with anyone or the GP. So what we do is we sit with them and we make those GP appointments. We often speak to GPs or we also have really good relationships with all of the primary care networks, so we can speak to the social prescribing teams or the health advisors and just say we have concerns about the woman, and it is a way for us to make sure that that woman is seen by a medical professional. We're not medically trained, we're not a prescriptive service, but what we offer is a network and a robust support system so women can feel more confident in achieving better health and lack of health inequalities. We work closely with partners in Merseycare, so we also we have a weekly surgery with one of the psychotherapists delivering IAPT at WISC, and we have a monthly meeting with them where we can cross-refer women. We had quite recently a sexual health awareness day. We worked with Access Sexual Health and one of the nurses there, because women were telling us that they don't go for smear tests, either because of sexual violence and trauma, childhood sexual abuse, or just domestic abuse, and that it's far too traumatic for them to go for those health screenings. So the nurse came to WISC, we had an open event where women could come up and just speak in confidence about what was going on for them, what the concerns were, get some of those concerns answered, and then a clinic was booked for the following week so that the nurse booked a woman in for a smear test there and then. We have women with neurodiversity, women with severe and complex physical and mental health disabilities who don't access health appointments. So it's really important to us at WISC that we bring those health partners into WISC in a place where women feel safe and comfortable, and they are more likely to engage with the health service. Everybody I've spoken to, every woman I've spoken to has nothing but praise for the medical support they receive from the NHS. they are absolutely delighted with the not only the physical health support, but also the support from the Macmillan nurses and the wider staff team in terms of supporting them psychologically, socially through the cancer treatment. It's the after care, it's the making sure that those women on discharge from services are signposted into community-based support to make sure that they have a more robust support in their own area or as close to home as they can. That's not medical. A lot of women who have had that medical treatment or that medical input don't really want to go back into medical services. They just want to be like other women. They just want to be around other women who don't have cancer. I did offer yesterday, I did speak to one of the women about specific cancer support services, and she declined politely. She said they tried to contact her, but she just wants to move on now and just find support for herself as a woman for those issues she's experiencing now with her mental health and her physical symptoms that aren't related to cancer. So if I could make one ask of NHS services, is that community-based support is included in the discharge plan for women, that those stronger community networks are created so that women know they have robust support after post-treatment, that they can go out and they can start to rebuild their lives again and recover from their experiences.